Hello and welcome to the latest Q&A with Asthma UK and the British Lung Foundation's in-house GP, Dr. Andy. He'll be speaking to Joe Aldrich about the latest changes to the COVID-19 restrictions, what people about to get their second dose of the vaccine can expect, and for anyone who experiences seasonal hay fever, Dr. Andy will be providing some useful tips as we enter grass pollen season. If you need any information about anything discussed today, you can find loads of useful links in the description below. And if you find this video helpful, please do let us know by leaving us your comments, liking the video, or subscribing to our channels. And if you feel able and you find the health information that we provide useful, please do consider making a donation today to help us to continue to defend the nation's lungs.
Andy, hello.
Hi Joe, how are you doing?
I'm very well, thank you, very well. Particularly now the weather seems to have taken a turn for the better, and we're slowly but surely seeing life return to some degree of normality.
Yeah, the weather's a bit hit and miss here down on the south coast, but it's warming up, which I think just shows that summer's on its way.
Yeah, as we film today, I'm looking out of my window at a nice bright blue sky. So yeah, fingers crossed, summer is coming. Hey.
Definitely.
Excellent. So, Andy, I think you know the drill by now, but for those watching at home, I'll be going through a few of the most frequently asked questions that we've been receiving here at Asthma UK and the British Lung Foundation. I'll be asking the questions to Andy, who will hopefully be answering them for me.
I'll try my best, Joe.
I'm sure you'll be fine. So, Andy, with restrictions starting to ease even further across the UK, what can people with lung conditions do to keep themselves safe?
So I think firstly, it's really good news that some of these restrictions are being lifted. I think we've all been feeling a little bit locked up for the last sort of few months or even whole year now. But the fact that things can be lifted a little bit is been achieved by the harder work we've all put in, by sacrificing, I suppose, our normal routines, but also by the vaccination programme. And because of these two things, we're now seeing that COVID levels are very low across the UK. And that is meaning that admissions and COVID-related deaths are coming right down. So it's all good news, and it's all very positive for this summer at least. But what I am sort of explaining to my patients and people who do contact us on our helpline is that COVID hasn't gone away completely. All that I will say is the chance of catching it has gone down a lot. So even though we can start to feel like we can get back to some normality, there are still some things I'm encouraging people to do to try and stay safe, not just to keep themselves safe, but to keep people around them as well. So the first thing that I would suggest to people to do is make sure you get your vaccination, and that's both parts of vaccination. Keep following the rules that are out there, not just from the government, but any that are local for your area as well. And keep remembering that you don't have to stick completely to what the restrictions say. They are the minimum that you need to be doing. If you want to take extra precautions as well as what you're allowed to do or whatever now, then that's absolutely fine. And if you want to do more to stay safe, then please do it. Some of the basics are worth keeping going with, or definitely keep going with. So hand hygiene, wearing face masks, especially in enclosed spaces, and making sure you're keeping spaces between you and other people where you can. So in groups or crowded spaces, the smaller the group and the more space that's there, the less chance that the virus has got to spread. If you're indoors, then make sure it's well ventilated, so that's windows and doors open. And also, I know there's a lot of people who just aren't ready to get back to normal yet, so don't feel obliged to rush back. Take your time, little steps to get back to what you know you're comfortable with, and slowly you can return back to normal. The one thing I would say is a little bit more difficult is for people who are now being encouraged to go back to work. And it's really important that you work with your employer and people in your workplace to make sure that you and your colleagues feel safe. I'll ask Joe to put a link on to the government website, which gives guidance for employers so people know what they can expect from their employer when they return back to work. But really important that people feel safe going back to all their normal activities.
I think we spoke we spoke last time about you've really got to care for other people's feelings. Really, not everybody's quite as comfortable as you may be, or as somebody else may be.
And even within friendship groups and work groups and even families, I'm seeing that there's a big difference. Some people want to follow the guidance to go straight out and start hugging their relatives and friends, and other people still feel uncomfortable being in an indoor space or an enclosed space with them. So I think it's really important just to bear in mind that even though it's exciting to get some of these normal things back, we just need to be aware that everybody's on a slightly different speed back to normal.
Exactly. Talking of ventilation, are there any kind of useful tips that you would give for that?
Yes, I think the main thing is where it's possible. And as you say, we've got some better weather now. Being outdoors is obviously the best and safest place to be with trying to reduce the spread of coronavirus among our groups. But if you are indoors, then having doors and windows open is a really good way of at least making sure there is some more ventilation, and not having too many people in the same enclosed space. So giving people space to breathe and have their own air, I suppose. Opening things up, that's probably the first thing I'd say.
Yeah, excellent. So I'm going to go on to our next question, but for people watching, just to say, when we're talking about COVID-19, all the advice that we provide is obviously correct at the time of filming, but as we're all well aware now, things can have a habit of changing. But we will include links so that people can find the latest advice from Asthma UK and the British Lung Foundation.
Cheers.
So with the vaccine rollout still progressing, more people are going to be offered their first vaccine, and some people with lung conditions will be having their second vaccine appointments coming up soon. What can people expect from their vaccine appointments, Andy?
Well, first thing is I'm seeing a lot of people who are still getting very emotional about getting their vaccine, whether it's the first or the second one. It means a lot to feel protected from something that's threatened us all in one way or another. And the success of the vaccine program is absolutely amazing. And it's one of the main factors that we're seeing such low levels of COVID in the community, in deaths, and people being in hospital. And it really is making a massive difference. But things to remember are that the more people who get both parts of the vaccine means that we can help to keep those levels low and help to protect everybody from coronavirus. No vaccine is 100% effective, so we can't rely on other people getting the vaccine to protect us. It's really important that we go out and get the jab for ourselves as well, when our time comes and you get invited. We know that the first jab is very highly protective, but the second jab gets everybody nearer to 100%. So it's really important to make sure that even if you've had one jab, go and get a second jab. For people with second jabs, I'm getting a lot of people who are worried about missing their appointment or not being invited in. And I think the first thing to say is don't worry. Most of the people who are arranging the vaccines are really well organised in how they're doing it. If you've arranged your first vaccine on the NHS vaccine website, you would have had the opportunity to book your second appointment on that website. But also you've got the opportunity to change it and review it if you want to as well. If your first jab was done by your GP or a pharmacist or even one of the hospital hubs, they should have given you a second appointment, or they will contact you with a letter or a text or even a phone call to make sure that you come in for that second one. And for the people who've had the Pfizer jab, that's between 3 and 12 weeks after the first one. And for the Oxford AstraZeneca one, it's between 4 and 12 weeks. So don't be surprised if you get a call any time in that sort of period. But yeah, plenty of advice is on our website, on the government website as well. But it is really crucial that as many people as possible get the vaccine and get both parts of the vaccine when they're invited.
If people haven't heard from their GP, would you just advise them to be patient, or should they get in contact with their doctors?
So I think if it's still within the 12-week period, it is about being patient. That there are some clinics that we're just not being able to arrange because we don't know when stocks are coming in. So we can't guarantee which day of which week it'll be coming, even though we know they are coming. But if you haven't heard by 12 weeks, I would definitely give whoever gave your first jab a call to see what's happening, just in case there's been any sort of error or you've just not picked up a message. If you were in one of the main vaccination centres or you arranged it through the NHS website, then you should be able to go on there and see when your next appointment is due or book the next one if that's what's needed.
That's great. Thank you, Andy. And for people watching, please do add your comments below. Give this video a like and do subscribe to the British Lung Foundation's channel, because by subscribing you'll be the first to hear about upcoming videos from Dr. Andy, and also our new series on research called the Hope Machine. Andy, this next one is a question that relates to your time outside of Asthma UK and the British Lung Foundation when you're working in your doctor's surgery. We're just wondering how things are going in the GP's surgery. Are you seeing more are you having more face-to-face appointments with your patients? And will people still be able to get remote consultations even as restrictions start to ease?
Yeah, so most of the NHS has been doing face-to-face appointments for a while, but they're not the automatic first choice for an appointment. At the beginning of the pandemic, there was a shift to do telephone first, as well as email consultations and video consultations. And the reason we did that was to keep people safe, not just patients, but our staff as well. And by stopping people coming together in surgeries, we were able to help prevent more spread of the virus. But we were still seeing people face-to-face when they really needed it. And most GP surgeries are doing that for people who either need to be seen face-to-face, it can't be done any other way, or if they need a physical examination. At the moment, though, we are seeing that primary care and GP surgeries are under a lot of pressure and a lot of stress. They're doing their normal work, and that's a lot of people with acute problems, as well as their routine issues as well. There's a backlog of people who perhaps didn't go to the GP surgery over the last 12 months who've got issues that are now harder to treat or need delving into in a bit more detail. We've got a backlog of tests and treatments that we need to get to people. And we're also running the vaccination program as well. So what we're seeing is that there's now a wider range of people who maybe wouldn't have been coming to the GP at the same time, contacting us through a whole different set of ways. So more people contacting us on the phone, sending in emails, trying to get face-to-face appointments. And yeah, it's creating a lot of pressure in the surgery and across a lot of surgeries at the moment. We're also at the time of year when we're starting to crank up our chronic disease management clinics. So people with asthma or COPD or diabetes. And we're doing those in a very similar way. So trying to contact people on telephone first or get them to complete electronic questionnaires. And for people who need to be seen or need specialist tests, we bring them into the surgery in as safe a condition as possible. So I suppose to answer your question, we're definitely seeing people face to face, but most people are being contacted by telephone first. And remote consultations, I think, are going to be here to stay, so that more people can access the GP when it's convenient to them, or from home by telephone and email and things like that. So yeah, I think we're all undergoing some change, whether it's GP surgeries or patients, in terms of how we cope with that and get used to it. But yeah, I think a range of these things is here to stay now.
Yeah, so oddly, the pandemic has brought about some kind of positive changes in terms of how you're able to see your patients and help people.
Yeah, I think it's positive for some people, and other people find it very frustrating or haven't got their head around the change yet.
Yeah.
Not everybody has got the internet or is comfortable waiting on the phone, but for other people, doing emails or telephones means they don't have to leave work, they don't have to leave home, and actually improves their access. So I think it's something we're all just getting used to. But in the same way that a few years ago, we all had to go in the bank to do absolutely everything. And now we can do most things on the bank through an app or on the telephone or their website. So yeah, I think the health service is catching up to other parts of society.
Yeah, but I guess it's like we were saying earlier. It's different people have different requirements, and the doctor's surgeries it sounds like they'll be trying to accommodate how people want want to see their doctors, I
Yeah,
guess.
and certainly I believe, and I know Asthma UK and British Lung Foundation believe, that we need a range of ways for different people to contact the NHS. Having face-to-face all the time and the only way of seeing people is inconvenient for people who are working or at school or even housebound. But actually, some people need to be seen face-to-face, and that shouldn't be neglected either. But yeah, we're all on a bit of a journey. I think these things are here to stay, and we just need to learn how to do it better to suit everybody. And not every GP or nurse that I work with enjoys working with these things either. They prefer seeing the patient in the flesh. So we've all got a bit of learning to do, I think.
Could you tell me whether you know anything about whether breathing tests such as spirometry will be restarting?
That's a really good question, and actually really good timing as well. These tests haven't really been happening for perfectly good reasons, keeping not only the staff but the patient safe as well. But that has mean there's been a bit of a backlog now of people who need tests to diagnose their condition or to investigate their breathlessness or their cough or other symptoms. We've had an update this week to the NHS, or in the last couple of weeks, which is giving us a bit more guidance on how we can restart it. The other test that they've given a bit of guidance on is something called FeNO, and that's a test which measures allergic inflammation in the airways and is useful for diagnosing people with a certain type of asthma called eosinophilic asthma. And it's not readily available in primary care, but it's coming more common now. People are more used to seeing it in hospitals. But that's another test that, again, seems to have been paused over the last year because just reducing the risk to people who are either handling the machines or having to do the tests. So what we've been advised is reassuringly that we shouldn't be doing the tests unless it's in somewhere that's safe. So in a room that's well ventilated and the hygiene is obviously good. And it's also been suggested that sometimes that might well be in a hub, so in a special clinic that's shared between several GP surgeries. It should only be performed by people who are safe, so that's staff who haven't got any symptoms that could be COVID. Staff are regularly testing to see if they've got COVID in their system, and people aren't going to work if they've got symptoms. Those staff as well are also wearing full PPE and obviously following all the hygiene advice that we've been given in health clinics to make sure that we're clean, but also the room is clean and clean between patients as well. We should expect, but obviously a bit more stringent at the moment. The test should only be done on people who really need the test, so not bringing the people in or causing them to be put at risk unless they need it to come up with a definite diagnosis or to actually affect what their treatment's going to be. So if there's other ways of coming to a diagnosis, or if we're certain of a diagnosis, or that test isn't going to change anything particularly, then we're being encouraged not to do it. For patients, obviously we won't be inviting patients in who have got symptoms that could be COVID. We might well be asking about whether they've got a temperature and doing temperature checks. And there's even a suggestion that some places might even be doing the lateral flow test, so the simple test to see if somebody's got COVID at the time. And that might be encouraged at home or at the surgery. We don't know yet. Other places have got to work out how they implement it. One of the things about FeNO and spirometry is sometimes doing the test can actually cause people to cough. And if you were invited in for spirometry, you'll be given very clear instructions on what you should do if you think you're going to cough or if you are coughing. So that will help to protect the room's hygiene, but also the staff member who's working with you. So I think it's reassuring there's some very, very clear support for what we need to be doing to keep people safe. But also that we're not being encouraged to do spirometry unless it's going to make a difference to the patient. So yeah, I think people can be reassured that if they're brought in, there's a good reason for it, and that they will be looked after and kept as safe as possible.
Andy, so the next question I've got for you is a seasonal one. Obviously now as we spoke about earlier, the weather is slowly but surely taking a change for the better. It obviously now means that we're starting to enter hay fever season. So do you have any tips or advice for people who get hay fever symptoms?
Yeah, and I'd say really good time to be talking about this because pretty much every other call I was taking from patients this week was related to people who were having a flare up of their lungs or even their nose and sinuses from something that was related to pollen. So hay fever can be mild or severe. It's an allergic response to pollens in the air, and the pollen causes a response with increased mucus or narrowing of the airways in the nose, the throat, and the chest. That extra mucus can make it hard to breathe through the nose. It can cause snoring, sneezing, an itchy nose, and can then lead to coughing and wheezing for some people. If it's affecting the nose, the best treatments to try are antihistamines and a steroid nose spray. And for most, well, you can get these from a pharmacist, or you can get them on prescription from your GP. Ideally, people would have started taking it at least a few weeks before the hay fever season started, but it's never too late to start them. But you get better protection if you start them earlier. If you have asthma or another lung condition, make sure you're taking preventers regularly. If you don't have asthma but are getting a tight chest or wheezing, or you're coughing a lot or getting breathless, then it's really important that you actually make an appointment with your GP to try and see whether you've got asthma as well, because it's really important, because pollen is a very major trigger for people with lung problems, and it can lead to asthma attacks, and people do actually die of asthma. So it's really important to sort of take it seriously and not just put it down to symptoms due to a little bit of hay fever. So yeah, lots of things you can do. Make sure you're treating it. Don't ignore it. Even if you're getting slight symptoms, that can still be an issue for people as well.
One thing that occurs to me, Andy, we often advise people to start taking their hay fever medication, obviously ahead of hay fever season, ideally. Yeah. Would it be advisable for people to just continue taking the hay fever medicine throughout the year, or would that have a detrimental effect?
It wouldn't have a detrimental effect, but it's not always necessary. Some people are more allergic to more things than others, and actually they do need to use their antihistamines or their nose sprays all the way through the summer season, and other people just need it at very certain times. And I'm sure you can share this, but we've actually got a page on our website which gives you a list of all the different types of pollens and what type of year they happen as well. And this can be a really good guide as to when to start your treatments, how long you might need them for. But it is a bit of trial and error, because everybody is different. Everybody will have their own combination of triggers. It's just important to pay attention to the fact they're there. If you're getting more mucus or a bit of itching in the nose or sneezing, or you're finding you're a little bit more tight in the chest than normal, or your peak flows are dropping, then just bear in mind it could be pollen that's your trigger, and to sort of start take preventative action to try and stop it causing an asthma attack.
And for everybody watching at home, please check the description below, where we'll be including lots of useful links through to the pages that Andy's mentioned. And also, just to say, please do add your comments, give this video a like, and do subscribe to the British Lung Foundation's channel, so that you'll be the first to hear about our upcoming videos.
Yeah, the other thing, Joe, is obviously keeping an eye on things like the weather reports, which now include information about air quality and pollens. And for people who follow Asthma UK or British Lung Foundation on Twitter and Facebook, there's regular updates on triggers such as hay fever on there. So that can be quite a useful prompt for people to know when to start their preventative medication.
Andy, I've got one final question for you. So with things easing across the UK, it's likely people will be going out more than they've been used to. So we know sometimes breathlessness can be caused by exertion. So do you have any advice on ways people can manage this?
So I'm going to start by asking you to put another link on the page, if that's all right. We've got the British Lung Foundation webpage on understanding your breathing and exercises you can do to help control your breathing. So for people who are getting more breathless because they've been doing more exercise, it's a really important way for them to feel in some control of how they're feeling. So definitely worth, even if you think your lung condition is well controlled, pay a visit. Most people who go there find that they've learned something new, or that they've had a refresher from when they've seen the respiratory physiotherapist or some other therapy like that. So definitely worth a visit. Lots of little hints and tips in there so that you can feel more in control of your breathing. So you're absolutely right that hopefully with better weather and less restrictions, we're going to start being a bit more active. We're going to be getting out and doing a little bit more, whether that's normal life, such as going around the shops or going to work, or even just doing more exercise to keep ourselves healthy. But there is a chance that we're not as fit and healthy as we thought we were beforehand. So firstly, if you're taking any preventative medication or regular medication, take it as it's been prescribed. If you've got a reliever inhaler, carry it with you just in case you do get breathless or one of the triggers sort of catch you out. Definitely worth gradually building up your exercise levels and pace yourself so you're not doing too much too quickly. And that way you can sort of get your confidence back up, but also just build up your fitness levels so your muscles don't use oxygen as quickly, your lungs and your heart are feeling that they can cope with the increase in exercise. And yeah, just make sure you pace yourself. Don't do too much too quickly. Keep an eye out for any worrying symptoms. So some of these will sound very obvious to people. If you're getting chest pain, stop and discuss it with a clinician. If you're getting breathlessness that is very slow to recover, again, this can be a sign that it's more than just feeling unfit or your normal lung condition, and maybe talk it through with someone. If you're getting a new cough, if you're bringing up sputum which has changed colour, if you're getting blood in your sputum or mucus, or if you're getting ankle swelling, those things are often the sign that there could be something else going on. Not necessarily, but they're definitely things that I would encourage you to get checked out. Finally, exercise shouldn't make people feel unwell. So even though it should feel like maybe at times it feels like hard work, if you feel unwell when you're exercising, then make sure you stop and you seek some medical support. But hopefully, by being sensible, by taking your medications regularly, by gradually building up what you're doing, we can get back to our normal levels of fitness and even do even better, so that we can sort of get on with life and be less bothered by our lung condition.
Sounds really helpful, and that sounds like a really positive note to end today's conversation on, Andy. So thank you once
I hope so.
again.
It'd be good to get out and see more people, but yeah, I'm still a bit cautious about bumping into too many people too quickly. Let's see how it all goes.
Exactly. Slowly but surely, we're getting there, though, which is obviously really
Definitely.
positive. Once again, just to say, all of the links that Andy mentions will be available in the description below. And as always, if you found this video useful, please do let us know by adding your comments below, giving the video a like, or by subscribing to the British Lung Foundation channel. Also, if you do find the health advice that Dr. Andy provides and that is available through our website useful and helpful, please do consider clicking the link that will be showing on screen now in order to make a small donation. Andy, thank you so much for your time again, and I hope we can catch up again next month.
Yeah, look forward to it, Joe. You take care.
You too. Cheerio.
Bye-bye.
Thank you so much for watching today's Q&A with Dr. Andy, brought to you by Asthma UK and the British Lung Foundation. Don't forget, you can help us help more people with a lung condition by liking this video, leaving your comments below, or subscribing to our channel today. And if you feel able to and you find our health advice useful, please do consider leaving a small donation today to help us to continue to defend the nation's lungs.